Yeah, welcome and thank you everyone for joining today's webinar. My name is Dr. Sophia Wenzel. I'm a licensed clinical psychologist and the clinical lead here at TrickStop. TrickStop is a therapist-assisted online program that can help you cope better with hair pulling, and it is bringing this webinar to you. And what we're going to talk about today is super important. It's understanding different treatment options for hair pulling and understanding what actually works. While obviously there are inter-individual differences between people, we have evidence so it can show what the most effective interventions are. I want to encourage you to stick around until the end. I'm going to talk for about 40 minutes, and then we're going to have a Q&A session where you can ask each and any question that might come up. It would be best if you write those questions down in the Q&A section here on Zoom. You can do that while I'm talking or in the end. Please don't raise your hand. I will not react to that, but you can write down the question and even ask follow-up questions, and I usually get through all of them. And also another maybe incentive to stick around until the end. If you do want to sign up for TrickStop, then you'll get a discount code, a promo code that will give you a $100 discount on your first subscription. Today we're gonna talk about alternative approaches, and what I mean by alternative approaches is different approaches to treating hair pulling disorder where we don't have enough evidence to support them. And I'm doing that because there's a lot of different recommendations running around out there, and we've also gotten a lot of requests to talk about some of those approaches. So I'll start with that. Then we're going to talk about medication, also a hot topic. And then we're going to get into the bigger chunk of today's webinar. We're going to talk about psychotherapy because psychotherapy is actually the most effective thing that you can do. But I know that the whole world of psychotherapy and the many different approaches that we have at this point can be confusing when you're not coming from this world, when you're not when this is not your profession. So I basically want to give you an overview of the different families of psychotherapy that we know, and then explain to you about the approaches where we actually have sufficient evidence to know that they can help you with your hair pulling. And to further illustrate that, I'm going to give you a case example and going to show you how possibly those therapeutic approaches might help a person. Then we're going to conclude and, as I said, do the Q&A. Okay. No questions at this time, so I assume everyone can hear me. Alternative approaches. There are many, and I will not go through all of them, but I chose a few, specifically the ones that I've been asked about. And interestingly, the one that we've been asked about the most is hypnotherapy. Now, I'm not a hypnotherapist, but I think I'm able to explain to you what it is. So, the idea in hypnotherapy is that your therapist helps get you into a kind of trance-like state, where you reach kind of a level of focus, concentration, and diminished peripheral awareness that leads to a heightened sense of suggestibility, where you are more open to outside ideas and images that help you kind of find inner sources of resilience and of progress. Many times the concern is that kind of you're under someone's control, or you kind of switch off and then don't even notice what is going on while you're in this state of hypnosis. That is not true. So it's been commonly compared more to like being completely absorbed in a book, movie, or in music. You're still there, but you're more open to new ideas and to discover and utilize resources within yourself. And there's actually some problems where hypnotherapy has been shown to be effective. I think the best example would be conditions of chronic pain. For example, irritable bowel syndrome. There we have quite strong evidence that hypnotherapy can help. Then we have moderate effects. So hypnotherapy can help to a certain degree with specific kinds of anxiety, especially phobias and test anxiety. And then we have many conditions where basically there's not enough evidence of hypnotherapy helping. And when I say, for example, limited evidence, I want to explain to you a little bit about what that means. So when someone just randomly says studies show or a study showed a certain effect or a certain result, that is actually a very general statement because there are different kinds of studies and they have different levels of strength of evidence. Okay, I'm not going to list all the different kinds of statistical approaches and kinds of studies here. I'm going to give you some of the most common examples and specifically some that we're going to talk about today. But so if we talk about a study that has that doesn't deliver strong evidence, we would talk, for example, about a case report. A case report basically means that a researcher or a group of researchers test an intervention in a very small sample and then draw conclusions from that. And this is valuable, but we're lacking a lot of things here, a lot of factors here that make those results generalizable. What we want is that a study can give you knowledge that you can then generalize on the whole population. You study something on a group of people with depression, but then you want to transfer this knowledge and apply it to everyone who suffers from depression, right? And if you have a very small sample size, then that is not possible because it might just by chance be 3 very specific individuals or 5 or 10 very specific individuals. That's not big enough. And then the second thing you always want is you want to have a comparison group. You can't just test an intervention on one group and then compare it to nothing, because then you have a lot of factors that might lead to the change that are not the actual intervention. So a better way to do it, which would be the randomized control study, is to have one intervention, one treatment, test that on a big group of people, and then have another big group of people with the same problem, for example, depression, that are a control group. That can be waitlist. They do nothing while the other group gets the intervention, or just some kind of general intervention, for example, relaxation techniques or something like that. And then you compare the pre and post effects between the two groups. And then those results are much more likely to be generalizable for the whole population of, for example, people who suffer from depression. Um, so as for one single study, the RCT, the randomized control study, is the gold standard. And then we even have papers, publications where researchers take every study that has ever been done on a certain topic. For example, one specific intervention for depression, and then they find 10, 15 studies that meet a certain standard. And then if they see, oh, wow, 9 out of 10 of those studies found that this intervention is highly effective. Wow, that's a high level of strength of evidence if 9 out of 10 studies found the same thing. And to top that, you have the meta-analysis, where you not only look at all of the studies that have been done on one specific topic, you also take all the scores in those studies and make a meta score and see like the average level of effectiveness if you compare all of the studies. So there's a huge spectrum of how helpful evidence can be. Why did I explain this to you right now? One reason is that if we look into hypnotherapy, or source of evidence is case reports. So basically a kind of research study that doesn't have that is not considered strong evidence. That's why we say this is limited or preliminary evidence, right? So in terms of hypnotherapy for hair pulling, at least I found two studies that were the most recent. They're still quite old. They're from 2001 and 2003. And both of them had a sample size of 3 people, children and adolescents, no adults. They did show effective symptom reductions based on hypnotherapy, which means we would never say based on those studies that hypnotherapy is not effective. We just say this is not enough evidence to say, oh, we think we strongly assume that this kind of therapy is effective, or we would recommend this kind of therapy to anyone who suffers from hair pulling. Yeah, I do find the idea very interesting of what happens in hypnotherapy, though. The first study that I mentioned here by Salzman kind of used imaginative hypnotherapy, where the patients were kind of suggested to describe their hair as weak and vulnerable and needy of protection, and were then kind of put in the role of patrons of their hair, thereby giving the participants a feeling of control, a sense of control of the situation. And the second study by Iglesias was done on children that had no awareness of their pulling, and through hypnotherapy, they could raise their level of awareness. And also, they were suggested, again, redefining their hair as their own property and kind of reaffirming the role of the child of having responsibility for the care and maintenance of their hair. So I guess what happens is kind of like a reframing of how they look at their hair and their own position and level of control. So that's very interesting, but the evidence is not strong enough for me to say, oh, now I can recommend hypnotherapy as a general treatment for hair pulling. Another, I would even say, group of alternative treatments for hair pulling would be all kinds of natural remedies and supplements. The list is much longer than the 3 examples that I name here. But I think the general common denominator is that we don't have any natural remedies or supplements where we know for sure that it can help with hair pulling. Those are some that are talked about a lot. So inositol, for example, is a carbohydrate that you find in the body that plays an important role when it comes to nerve functioning, cell signaling, and neurotransmitters such as serotonin, dopamine, and GABA, where we know they are involved in hair pulling. So the assumption that inositol might have a positive effect is not flawed at all, but research doesn't show that it's effective. Actually, there is a study from 2017 where inositol didn't show any effects above the placebo effect. So here we actually have evidence that discourages the effectiveness of inositol, whereas in hypnotherapy, we just lack evidence that it's effective. We don't have evidence that it's not effective. And then omega-3 fatty acids and vitamin B12 are a little bit similar. There's not sufficient evidence that they would help with hair pulling as a standalone treatment. But for example, omega-3 fatty acids have been shown to be a valuable adjunctive treatment for depression and sometimes even anxiety, which means they aren't a standalone treatment for depression either. But if you have some treatment for depression, for example, therapy or medication, and then you add the omega-3 fatty acids, it might give you additional value. And by reducing symptoms of depression, obviously that can also have a positive effect on hair pulling. The same goes for vitamin B12 specifically in cases where you have a vitamin B12 deficiency. So it might be interesting to check if your vitamin B12 values are normal. If you have a deficiency and if you feel you're suffering from symptoms of depression or anxiety, then vitamin B12 might have some kind of positive effect on that, and then through that, some positive effect on hair pulling. However, as I said before, none of those substances can help you directly with hair pulling. And if you have no depressive or anxious symptoms, then it might not have any effect whatsoever. Yeah, so those are the alternative approaches. Then we have medication. And again, let's remember the different levels of strength of evidence that I showed to you. So if it comes to medication, since 2024, we have a systematic review on which medications can be effective when it comes to hair pulling disorder. So that means that someone looked at all the research that is out there in recent decades that looked into effects of medication on hair pulling disorder, and then they chose 23 articles that meet a certain standard, a certain scientific standard, and then looked and checked whether there are common recommendations, common results that show up in different studies by different researchers. And they actually looked into a lot of different kinds of medications. I think the most important finding is that there is no gold standard medication for hair pulling disorder. There's no one medication that would be the general recommendation, just like we say, okay, SSRIs are the general recommendation for depression, right? Or antipsychotics are the general recommendation for schizophrenia. So for hair pulling disorder, we don't have something like that. But we do have some kinds of medication that show promise. So one of them, which I mentioned before, is N-acetylcysteine, NAC, which is a fairly harmless medication that actually shows quite impressive results as an adjunctive therapy, which means in combination with psychotherapy in this case. NAC reduces glutamate activity, and glutamate is involved in hair pulling symptoms, and it's very well tolerated. You have side effects are very mild and very rare. So yeah, it shows a lot of promise, NAC. And then another substance that can help with hair pulling disorder are selective serotonin reuptake inhibitors, in short, SSRIs, which is the kind of medication that originally was used and is still used for depression. It's also used for anxiety. In higher dosages, you would also use it for OCD. And it can also be effective for hair pulling disorder, but it cannot heal the hair pulling disorder or completely treat the symptoms. It can just reduce them to a certain degree, and the evidence for the effectiveness of SSRIs is a little bit old, I have to say. And most of the studies cited in this systematic review that looked into SSRIs and hair pulling were older than 2014, which is not like insanely old, but it's also not very recent. It means that in the last 10 years, we didn't get any studies on this topic. But it can be effective. It can be combined with NAC. The only thing is that SSRIs have usually more serious and more common side effects, such as weight gain and sexual dysfunctions. I'm not a psychiatrist, very important to note. I'm not giving official recommendations for medication here. If you consider medication for yourself, you always have to talk to a psychiatrist first. This is just what I understand as a person with a research background from studies that I read. Okay, and now the most important part when you want to learn new ways of coping with your hair pulling disorder, which is psychotherapy. Psychotherapy is the best way to treat hair pulling disorder. And as I said, I have this kind of ambitious, had this ambitious idea of giving kind of like a family tree for psychotherapies to give you some overview, because it really is very confusing. Even I hear about therapeutic approaches that I have never heard about before frequently. And it's interesting because I manage an international team of therapists here at Trickstop, and I've lived in several countries myself. And so the therapeutic approaches also vary from country to country, which is interesting. So certainly this approach is probably also biased by my experience in the countries where I studied and practiced. So every psychologist here that's listening and disagreeing, I'm sorry, I might have made mistakes here, but like I think I'm not completely wrong. Um, so in my opinion, there's four big groups of psychotherapy. You have psychoanalysis. You could possibly say it's the mother of psychoanalysis, is the mother of psychotherapies, obviously founded by Sigmund Freud and then continued by his disciples. Then you have behavioral therapy, which is based on research by different people, such as Pavlov, Skinner, and Bandura. And Pavlov is quite famous for his experiment with the dogs, where he presented food to dogs and rang a bell at the same time, and then later on could prove that only at the ring of the bell the dogs would salivate because they already expect the food even if they don't get it, which is a process called habituation. So behavioral therapy basically looks into different ways that behavior is learned. Then you have humanistic person-centered therapy founded by Rogers, and family and systemic therapy founded by Palazzoli and Minokin, which is an approach where we not only look at the person who presents to therapy, but at their whole system of people who are close to them, at their family system, to see how those dynamics kind of cause or maintain the symptoms. And all of those approaches are very valuable and interesting. And if you get into it, each one of them, it really makes sense. And I think they all can be effective for certain problems. Each one of them, if you look into them, you can build a whole family tree around them as well. As you see, it can get very complicated with this example of psychodynamic therapy and psychoanalysis. And this is not even all, right? So I'm not going to do that. I'm not going to now get into all of the details of all of those different families of psychotherapy. I'm only going to get into one, which is behavioral therapy, that was then later on continued to cognitive behavioral therapy, in short CBT, because that is the kind of therapy where evidence shows the best effects for hair pulling disorder. We have limited, lacking, or only preliminary evidence when it comes to all kinds of other interventions for hair pulling disorder. And the most effective treatment is cognitive behavioral therapy. So that's why here I'm going to go deeper and explain you more about it. And as you see on the left, I kind of named those stages, first, second, and third wave, because that's how we call the different stages of development of cognitive behavioral therapy. The first wave was behavioral therapy, meaning to understand how behavior is learned and how behavior can affect our emotions. And then the second wave was to understand better how thoughts can impact our well-being and our emotions. And then the third wave took principles of cognitive behavioral therapy and added something additional to it, something based on some of them childhood trauma, some of them emotional approaches, and a lot of them principles such as mindfulness. I listed some examples here, for example, acceptance and commitment therapy, in short, ACT, schema therapy, mindfulness-based cognitive therapy, and dialectic behavioral therapy. Now, if we look specifically at hair pulling disorder, the most effective way to treat hair pulling disorder is just basic cognitive therapy, cognitive behavioral therapy, and the adaptation of cognitive behavioral therapy that was specifically developed for hair pulling disorder, basically body focused repetitive behaviors such as hair pulling disorder or skin picking, and also for tic disorders. This specific adaptation is called habit reversal training. So it's kind of like the version of CBT that we use when we treat hair pulling disorder. And that is the gold standard, as we know, based on research by now. And then we have some of those third wave treatments such as ACT, MBCT, and DBT that can help if you combine them with cognitive therapy. It can make the cognitive behavioral therapy even more effective. So I want to explain to you a little bit more about cognitive behavioral therapy and the specific adaptation, the habit reversal training that we use for hair pulling disorder. Um, so my clinical training after finishing my master's degree was really with a huge focus on cognitive behavioral therapy. So I usually talk about CBT as my native language, while I learned several different additional therapeutic approaches after that that I also find extremely valuable. I feel at home in CBT, and the more I learn about CBT, and the more I practice it, I just realize everything is a cycle. Every problem can be put into a cycle, and then CBT, what it does, it finds the spot in the cycle where we can break it. And this cycle usually contains thoughts, emotions, and behavior. The basic assumption of CBT is that our thoughts, behavior, and emotions are interconnected and influence each other. And usually, when someone comes to therapy, their problem or what burdens them is an emotion. It's they're depressed or they're anxious or they have anger management issues. But you cannot directly change an emotion. As all of you know, when you're anxious and someone says calm down, it doesn't work. If you're sad and someone says cheer up, it doesn't work. So you can't just actively change an emotion. But through changing your behavior, you can affect an emotion. If you feel depressed and you go out for a run or you meet with friends, you will usually feel a little less depressed after that. So you use your behavior to affect your emotions. So you have more control over your behavior than over your emotions, and you have limited control over your thoughts. You cannot really control the thoughts that come into your head, but you can control how you react to those thoughts. You can control whether you want to take them seriously, whether you challenge them, whether you build awareness of them, whether you want to reframe them. And so those are typical CBT techniques. If we take this and kind of transfer it to hair pulling disorder, then surprise, surprise, you see a cycle. That starts with a trigger that creates the urge to pull. Then, in most cases, it's hard to resist the urge and the actual pulling occurs, which leads to a short-term relief. And then in the long run, it leads to negative consequences. Emotional, for example, you can feel ashamed or guilty, but sometimes also physical, because you might have bald spots. And that kind of maintains and upkeeps the cycle. And as I said before, what we do in CBT, we try to break the cycle. And so, did I say DBT? What we do in HRT, or generally in CBT, so many abbreviations, we try to break the cycle. And so the first very important element of habit reversal training, the base of habit reversal training is to create awareness for this cycle. And by awareness, I mean two things. Awareness for the actual pulling, because sometimes we're not aware of the pulling. And the second is awareness for the whole pattern of the pulling. Why am I pulling? Are there certain situations or places or triggers that repeatedly lead to the pulling? What kind of thoughts, emotions, or movements are related to the pulling? So we need both of them. You need to be aware of when you're doing it, and you need to be aware of why you're doing it. And once this awareness is created, and we are aware of the cycle, we can try to break it. And there are two very strong intervention strategies when it comes to habit reversal training. The first one kind of um, tackles the trigger, which means through stimulus control, that's what the technique is called, we try to reduce triggers in our day-to-day life. We try to reduce the situations in which the urge comes up. So, for example, for a lot of people, a typical situation where pulling occurs is in the evening. And because then, the guard is down and you're tired and you have less self-discipline. And a stimulus control technique would be something to reduce this uh, reduce those triggers by, for example, taking a shower early, making your hair wet, and putting what do you call this? Pulling it up, right? For a lot of people, that would reduce the urge to pull the hair, which might be stronger in the evening. So that would be stimulus control. And then the other technique that I'm talking about is called competing response, which means that we try to, when the urge is already there, when stimulus control techniques haven't helped, we try to introduce an alternative response, something that we do in response to the urge that is not pulling, in order to avoid actually, pulling out hair or damaging our hair. Now, if we look at those third wave approaches, there's different ones. And since I'm already giving you so much theoretical input at this point, I want to focus only on one of them that I find very valuable, which would be acceptance and commitment therapy. So I want to explain to you a little bit about that. Um, acceptance and commitment therapy is actually a very, very popular approach that is used by a lot of psychotherapists and that can be used for a lot of different problems. As I said before, it uses elements of mindfulness, and it's a really good addition to habit reversal training, because habit reversal training, as you noticed, is quite behavioral. It's like, how can you reduce the triggers and how can you do something else? It is less focused on your emotions, on difficult thoughts that make you feel ashamed. And this is where ACT can come in and be a really nice addition. And when it comes to ACT, we often talk of the hexagon of ACT. So six techniques or principles that are important when it comes to ACT. So the first one would be mindfulness, being present in the moment. That's the base for everything. The second one would be values, to define what is truly important to you in life, to be aware of that. And then, as a third point, to take committed action towards those values, to think about, okay, what of the things that I do brings me closer to my values in life? And how can I do more of that so I feel some sense of purpose or fulfillment? And I'm going to give you examples for that because I know it sounds a little bit abstract. Even more abstract is the concept of self as context. It basically means that you kind of, specifically when you're upset, when you're having a negative thought, when you're having a difficult emotion, you take a step back and remember you are not your emotions. You are not your thoughts. You are the person who observes the stream of thoughts or the stream of emotions that is going on in your life. And while thoughts pass and emotions pass, you are always the same, but you're not your thoughts and you're not your emotions. And this really relates to the concept of cognitive diffusion, which means if you have a difficult thought come up, don't take it as truth. Don't take it at face value immediately. Take a step back. It's not, I'm such a loser for pulling my hair. No, wait. I'm having this difficult thought of I'm a loser for pulling my hair. It's just a thought. It's not the truth. It doesn't need to define me, right? It's just an event that happens in my head. And the last one, super important, experiential acceptance. A lot of the reasons why people come to me, why people decide to do psychotherapy is because there is a certain experience in their lives that they are avoiding, that they don't want to experience. A person who has anxiety doesn't come to therapy because of the anxiety. They come to therapy because of all of the things that they avoid because feeling the anxiety is so difficult. If someone has social anxiety, they don't come in because of the social anxiety. They come in because they can't have a presentation at work, because they avoid social gatherings, because they don't speak up when they're around strangers. And this is what causes the problem. All of the things that they do to avoid feeling the social anxiety. And what we do in therapy oftentimes is to push them towards feeling this feeling and understanding it's hard, it's super difficult, but you can take it and it shouldn't stop you from doing what's important to you. Um, so that's the concept of experiential acceptance. Don't worry, I'm going to give you some examples of what this could look like for hair pulling disorder. So yeah, let's look into a case example. Let's say we have a graduate student struggling with hair pulling disorder who pulls specifically when they're stressed or while studying. And now let's think how different principles of habit reversal training or acceptance and commitment therapy could help that person. So as I mentioned before, the first and most important part would be to create awareness. And when I work with clients, there's usually different levels of awareness. Sometimes this is not such a big deal. Sometimes they are already aware of most of the pulling and they already have an idea of what their triggers are. And sometimes you have to start at the beginning, and then this kind of creation of awareness will take some time. And what we do is self-monitoring. It means every time you notice yourself pulling, you notice before, you notice afterwards, you write it down. In an app, in your journal, you write down how intense it was, what thoughts, emotions, situational factors you noticed. And then eventually you have many, many logs, and then you can derive patterns and you at the same time increase your level of awareness for the actual pulling. Then the second step would be to reduce triggers. For example, um, covering mirrors, if mirrors make you want to pull your hair, or changing positions while studying so your hands aren't as close to your head or to other pulling sides, wearing a ponytail, wearing a hat, putting something on your hands that makes the pulling harder, things like that. And then finding effective competing responses. For example, if you go to a boring lecture, take a knitting set, take a fidget, take something where you can scribble, where you can draw, sit on your hands. There's many, many different options. I always recommend one of our webinars done by Laura Sentner, where she did a whole webinar on different kinds of fidgets. Sometimes it takes a little bit of trial and error, but I think everyone can find kind of a toolkit of different fidgets that work for them, that give them some kind of stimulation that helps to resist the urge. So that would be the behavioral base, the HRT base of our intervention plan. And then we can add ACT to that. For example, defining values. Joanna could define her values. And she might find that friendships, keeping friendships, going out with friends is a very important value to her. Now, as we all know, with hair pulling disorder, shame plays a huge role, usually. And sometimes when you feel self-conscious, when you've just pulled your hair, when you feel like there's bold spots that everyone can see, then going out is difficult. And so ACT in terms of making you aware of what's truly important to you switches the focus from the pulling to, okay, I want to reduce the pulling, that's important, but what do I do want to do in my life, right? What's important to me? What gives me a sense of meaning in life? And then it might make the decision to go out, even though you feel self-conscious after pulling episode, easier. And that will have so many beautiful consequences. First of all, you will notice that it probably is going to be not as bad as you thought. You might have a lot of fun, which will improve your mood, which will maybe reduce pulling afterwards. And it can also reduce feelings of shame and give you a feeling of control and fulfillment. Then also techniques that I find very helpful for people who suffer from hair pulling disorder is the whole diffusing, is taking your thoughts less seriously, because sometimes we have this really, really harsh inner self-talk. It's like, okay, I just pulled. That means I have no self-control. I feel the urge, which means I need to pull right now. To take a step back from those thoughts, evaluate them. Okay, I'm having this thought. I'm having this thought now. I didn't have the thought last time. Do I want to believe this thought? Can I laugh about this thought? Can I do anything else that makes me take this thought less seriously and don't take it at face value? This is where cognitive diffusion techniques can be really helpful. And finally, as I said, the concept of experiential acceptance is very important, and the experience that you need to accept that you're having when you're hair pulling is the urge, right? And the urge is a very strong experience, one that you really want to avoid. But if your answer of avoiding this urge is to pull your hair, then that will just maintain your cycle, right? So to learn to accept, be mindful of, and accept this feeling of the urge is very, very difficult, obviously, but can be very helpful. And there's like this whole new idea that I notice people call urge surfing, where you kind of consider the urge as a wave that comes up, it washes over you, you feel it's almost irresistible, but then it also goes away, even if you don't pull. And to ride the surf out, to be mindful of it, but don't not react to it, that's where acceptance and commitment therapy can be very helpful. I'm a little bit over time, I'm so sorry. I'm gonna try to make this quick. There's a lot of research on habit reversal training and acceptance and commitment therapy, and of how effective it can be. But I do want to talk about one specific research study because we've done it here at Trickstop in combination with our sister or brother program SkinPick. This is not per se advertising. This is really a research study that we did, that we published in a peer-reviewed paper. And it means that we basically looked into the data that we had at this point of 1,423 people who went through the program, through either of those programs, and underwent an online treatment plan via digital sessions based on habit reversal training and ACT with the help of their own individual therapist. And we saw really, really positive results of significantly reducing the severity of the skin picking / hair pulling behavior. We saw that those improvements were progressive over time. So the longer people stayed in the program, the more effective it was. And we also saw that the more sessions someone went through, or the more they communicated with their therapist, also made their results stronger. So we saw, for example, that within 3 weeks, 73% of clients already experienced a reduction in symptoms. And that's the beauty of CBT sometimes, that it can work really, really fast, not only with hair pulling disorder, but specifically with hair pulling and skin picking. Sometimes the results come in very, very fast, and that's amazing. And then within 3 months, we saw an average symptom reduction of 41%. Yeah, so that would be one example of how effective habit reversal training and acceptance and commitment therapy can be, but it's definitely not the only one. To conclude, as the field of psychotherapy advances, we see more and more approaches emerge. It can be very, very confusing, but when you look at therapeutic approaches for hair pulling disorder, it's actually not confusing at all. There's one gold standard. It's the CBT treatment for hair pulling disorder called habit reversal training. And if you combine this with ACT, DBT, or mindfulness-based therapy, then it can be even more effective. Another thing that you can add to your treatment might be medication. There's no gold standard there, but promising substances such as NAC and SSRIs. Before we go into the Q&A, I want to remind you that we have some free resources. We have an online forum and blogs. You're on our website, trickstop.com. We're on all the social platforms. And also, I really want to encourage you to check out our YouTube channel, where we as of tomorrow, you will find this webinar, but you will also find all our past webinars. It's an amazing library of knowledge on hair pulling disorder that we've built over the years and can answer almost any question you might have. Yeah, if you do want to sign up, here's the promo code webinar 100. And now I want to check if we have some questions, because I'm way over time and I want to get to those. Yes, we already have some. Okay, recently my hair texture changed. It went from straight to curly. Will this change back? That's an interesting question. I feel I'm not enough of an expert on hair texture to answer that. It would also be interesting to understand why your texture changed, if it's like some treatment or some kind of change in your body. The texture of your hair can definitely influence your pulling behavior, right? Some people look for specifically rough hairs or curly hairs or gray hairs. So my guess is that that's why you're asking, but in terms of hair texture and its changes, I think a dermatologist or maybe even someone who, how do you call this, like who does cosmetics on hair might know more about that than me. As far as the NAC, what is the dosage that's recommended? So I'm so sorry. Those two questions were by the same person, and I'm not the expert for either one of them. So in terms of the dosage, there is no official recommendation by any health organization, right? It always should be evaluated by a doctor. Obviously, you need to talk to a doctor anyways if you want to take it. So I would listen to them. I would never voice any recommendation for something like that. If you were asking me about, for example, SSRIs and depression, I could at least, quote what the NHS or whoever says about that. But with NAC, we don't even have that. So you would have to talk to to a doctor or a psychiatrist for that. Does the 12 steps method work for hair pulling? See, now I don't even know, is the 12 steps method, is that the AA method? What do you mean by that? I don't know this method. However, as I know that CBT and third wave DBT treatments are the only ones where there is enough evidence, I'm going to say no. Whatever this is, I know all the evidence when it comes to hair pulling disorder. I've never heard about this, so it's probably not effective. It might be effective with some kind of other problem, for example, depression or addiction that might add to the hair pulling, but it's not a standalone treatment for hair pulling. When I'm pulling, oftentimes I realize I am, but don't care in the moment and still pull. Would CBT help with this? Yes, I think so. What you're experiencing is very, very common. It's that when you're pulling, you only think about the short-term consequences of what you're doing. The fact that if you pull now, it's going to feel good. But if you do some cognitive restructuring, if you look at the long-term consequences of what you're doing in more depth, if you reframe your thoughts that you're having during the pulling, if you start practicing behavioral strategies such as stimulus control and competing response, that can absolutely help you. And this human behavior of like in the moment, forgetting what your current behavior will do to you in the long run is, you can see it everywhere, right? It's at the core of so many different problems. Procrastination, right? I think about like, I don't want to study right now, but in the long run, I'm going to regret it. Drinking one too many glasses of alcohol. It's a lot of fun now. I don't think about the fact that tomorrow it's going to suck. But you can work on that for sure. Can you provide suggestions or advice for how to talk to a teenager when they are pulling without exacerbating the anxiety and behavior? Wow, very complicated situation, specifically with teenagers. I did do a webinar specifically on teenagers, I think at the end of last year. So I really want to encourage you to look into that, not because I want to praise myself, but just because preparing that webinar was so interesting. And I learned so much about the teenage years and how the brain functions in those years. And I think I also gave some recommendations on how to talk about the topic. Be prepared for a lot of trial and error. There's no one right way, but I do give some recommendations there. And another webinar also where I talk about, I think, in general, people who talk about and to people who support others with hair pulling disorder. So yeah, I would recommend to you to go to our YouTube library and look that up. It's quite recent. You should find it. If you can't, just write an email to our support team and we'll find it for you. And then you'll get a lot of information. But definitely not easy. And the fact that you already think, okay, how can I do it without exacerbating the anxiety or the behavior shows that you have a certain level of sensitivity and you don't just impulsively react. You say, okay, well, this is a sensitive issue. How can I do it the best way? So that's already a great start, I have to say. um, Another question. Wait, how are we in time? Oh, we're good. What happens if I am triggered by studying, but I am always studying? Excellent question. This is similar to people who say, for example, I'm triggered when I sit at my computer, but my work is 99% sitting at my computer. So if that's the case, there's different strategies that I would advise. For example, switching up your studying situation, studying at the library, studying at home, studying with friends, studying in a coffee shop. So in different places, also switch up the position of your body when you're studying. Like if you're trying to memorize something, get up, move. If you're listening to something, do something with your hands at the same time. If you have a table where you can study standing, that would also be excellent. Take a lot of breaks. What happens when studying or working on the computer is your main trigger is that you lack stimulation. Okay, your senses are understimulated. Human bodies are not meant to just read all day long or sit in front of a computer all day long, and then what we call nervous energy um, builds up because our body is doing nothing. We're just like using our brain all the time. And then you have to stimulate yourself. You have to switch it up. You have to use things that stimulate your senses. This can be your sense of smell. Obviously, your sense of touch is very important, fidget toys. And then also interrupt the studying. Don't sit for hours. Do the Pomodoro technique where you sit for 20, 25 minutes and then you take a break and then you continue in a different place or in a different position. Yeah, this is a very common trigger and a tricky one for sure. Obviously, Uh, Working on that with a therapist would be especially helpful. How long does the patient undergo CBT to see relief? Is it lifelong? There is no one answer to that. As also, therapy success doesn't look the same for everyone. For the vast majority, the hair pulling becomes a problem that you learn to cope with, where sometimes it raises its head, it comes back a little bit, but you manage to cope with it really well, and you hold the symptoms as at a decent low level. For some people, it's a lifetime struggle, and for some people, they find full relief, they find full recovery, and they stop. So the outcome differs from person to person. Also, the length of therapy. For some people, it's literally a few months and then you're done. And for some people, it can be longer. Some people do therapy once, then they're fine for a while, they relapse, they have to try again. Um, but it does, like you're asking, is it lifelong? It does not have to be lifelong. Your coping and managing the hair pulling is lifelong, but being a therapy doesn't have to be lifelong. And CBT specifically is a therapy where you set goals, you get to the goals, and you finish, right? Your goal is not to keep your patients for years. Your goal is to help really reduce the symptoms. Mm, Okay, two more questions. I have tried to engage with treatment, CBT, HRT, medication, acceptance, and commitment therapy many times over the past 15 years, but always end up continuing pulling my hair. What would you say to someone who feels that their hair pulling is treatment resistant? That is a different question, a difficult question, because, like, to tell you the honest truth, obviously CBT and I mean, HRT and acceptance and commitment therapy are variations of that, isn't 100% foolproof. So it can't help everyone. Um, I do always think that the fact that a specific treatment didn't work for you once doesn't mean that it will never work for you. First of all, because you change, your life circumstances change, your brain matures. Um, right? Like we are constantly evolving as people. Second of all, science evolves and even habit reversal training, right? We're always learning new things. There's new models of how to do the habit reversal training all the time. And thirdly, sometimes it's also about the therapist. Um, some therapists are not experts when it comes to BFRBs. Here at TrickStop, we have kind of the privilege that all of our therapists see so many clients for so many years that all present with the same problem, that they have such a vast experience that sometimes they manage to help people that have done HRT before, that have done CBT before. So I don't want to rob you of all hope, but I also don't want to minimize what you're saying, because some people really are treatment resistant. That just happens. And I don't know you personally. I just think it's always, if you're suffering from your pulling, it's always um, possible to try again and to succeed more. That's my experience. Um, okay, we're out of time, but I'm gonna look at the last question. Is there any evidence that hair pulling and eating disorders co-occur, and does that impact how you would approach treatment? Yes, hair pulling and eating disorders can co-occur. It's not the most common comorbid disorder that we see with hair pulling. Um, but there is definitely people who suffer from hair pulling disorder have a slightly higher likelihood to also have an eating disorder than just any person has a likelihood to have an eating disorder. And does it impact how I would approach the treatment? It really depends on the case. I mean, if I have someone with an eating disorder that are malnourished, where their body doesn't get the energy it needs, I would never start treating the hair pulling. I would always, first of all, treat the eating disorder so they get to a place where they're well enough to treat different other problems. So I think I would evaluate what is more urgent at the moment, and my tendency would be to think that the eating disorder might be more urgent. Um, Sometimes there's slight overlaps, right? So DBT can be helpful for eating disorders, and some DBT strategies are a little bit look a little bit similar than habit reversal training. But yeah, I mostly would evaluate where I start first. I think I wouldn't treat both of them at the same time, but that might be like a stylistic choice of mine. And then in terms of the habit reversal training, trying to think, I don't think it would change anything. And I think that acceptance and commitment therapy as an approach, because it's a holistic approach, might be effective for both. Yeah. Um, okay, then someone said thank you for the webinar. I'm happy you enjoyed it. Thank you. And one last question, should I find a psychologist or a psychiatrist? If it's either or, start with a psychologist. Um, okay, thank you for all of those questions that really make me feel like you listened to the webinar and you reflected on it and you were engaged. I really hope I'm going to see you around for the next webinar. And if you wanna, if there's anything you've missed, obviously you can go to our YouTube channel to watch the recording. And yeah, I hope you have a great rest of your day wherever you are. Thank you.